Hey, everybody, I just wanted to hop on and introduce myself. And I really hate this Zoom background. It's like all fuzzy. It makes me look weird. Okay, anyway, my name is Heather Ranillo. I'm going to be your instructor for this course. Um, I just got hired and I'm jumping into this, but you bear with me. We will get you through the next couple of weeks. I am a family nurse practitioner. I also teach nursing fundamentals at St. Petersburg College in Pinellas County, Florida. So I'm not new to the teaching world, but I am brand new to Quest, like brand new. So I wanted to hop on this week. I don't even know why my mouth always looks crooked, but that's just the way my face looks. I wanted to hop on to drop this video because there's a lot of questions about the concept map. And I wanted to make sure that I understood the assignment properly. So I took it off for week 1, but it is going to show up again next week. So let's review a concept map. I actually don't know where you're at in your nursing education because I'm still like learning the lay of the land here. So from what I'm hearing is you've never done a concept map before. So in a nutshell, a concept map is taking a little concept and then breaking all the little pieces down. So let me try to share my screen so we can go over. Okay. Let's share this guy. Okay, so you have in your Quest portal, you have the directions. So you're going to take the word, or actually it's PDF. At the bottom under number 4, you see it says Foundational Concepts of Mental Health Nursing PDF. You're going to download and open that. That's going to give you your case study, and it's also going to give you the box that you need to fill out. I personally use Adobe Sign or Adobe whatever to fill my stuff out. If you don't have any of those programs, if you print it and handwrite it and then scan it and drop it in the box, whatever works best for you, as long as your handwriting is legible for me. All right, so we're completing the concept map using these following directions. Identify relevant subjective and objective assessment data. All right, so first you need to remember what is subjective and what is objective. What is something that you can see as the provider and what is something that the patient is telling you. All right, so you can identify those things, put them in the right boxes. Based upon the assessment information, we're going to identify and prioritize top 3 client problems. If you've learned Maslow's hierarchy of needs or anything in that realm, we always need to pick problems that are life-threatening first. So airway, breathing, circulation, perfusion are always a top priority. And then it trickles down into those ones that are still important, but aren't going to kill you priorities. So then you're going to write a client problem in each of the client problem boxes. Below each client problem, then you're going to support that data. Why is this a problem? You could say like, I know this is mental health, but just to break it down, we'll say hypertension is a problem. And then under supporting assessment data would be, blood pressure of 140/90 on 2 different, dates and times, or, BUN and creatinine levels are off, patient complaints of headache. All those things are assessments that fall underneath of that client problem. Identify a potential client outcome per client problem. So we need to do our nursing process. We are assessing, we are diagnosing, diagnosing. We have to then create a plan. We have to implement the plan, and then we have to make sure that our plan worked and evaluate it. So what's a potential client outcome? Patient will verbalize need for low salt diet. Okay, that's an outcome. Patient will eat a low salt diet. Identify important nursing interventions. That's going to be educating about the diet, having the client choose from a menu and making wise, decisions. And then those all go into those intervention boxes. Of course, now apply that to mental health. So review the unfolding clinical scenario information. What additional factors should the nurse include in the plan of care for this client? Tell me your thoughts. What findings require immediate follow-up? Again, life-threatening. The client tells you that they are a risk of harm to themselves or others. They have a plan. They're doing things that are of unsafe behavior. These are things that need immediate follow-up. If you are starting if the patient provider starts them on new medication, these require immediate follow-up. What education should the nurse provide? Depending on the client problem, I'm sure in your book or other resources you have, you can find different education. That's very important. Always education about medications. You can't go wrong using that one. How will you determine if expected client outcomes are achieved? Depending on what problem you chose, how would you evaluate that what you did worked? And like if you were choosing, let's say that somebody's on an MAOI. Sorry, my birds are very loud today. Let's say a patient's on an MAOI. Not many patients are still on these meds, but they are a tried and true antidepressant from back in the day, and there might still be people who need to be on them. So part of your teaching can be about how you cannot take an MAOI inhibitor with like basically any other medication. No cold meds, no over-the-counters. Everything needs to be ran through their psychiatrist. If you've ever looked on the back of, I don't know, Tylenol cold and sinus, it will say, do not take if you take an MAOI inhibitor. So you could do the education on that. You could do about how you cannot drink red wine or eat aged cheese or any of the things that the dietary changes you have to make when you're on an MAOI. And then your expected client outcome then would be patient verbalizes they will no longer, drink or eat and then list the things. Or like at the 4-week follow-up, patient states that they took their medication on time every day for the past 14 days. These are things that you can evaluate because they are of substance. They are achievable goals and they are measurable goals. You don't want to make where I am going to throw these birds outside, but they are my emotional support birds. I want to, and of course I lose my train of thought. Good old ADD brain. You'll learn about that in mental health nursing. So you have to make goals that are achievable and measurable. You don't want to make something like patient will quit smoking in 3 days. Okay, because that's not going to happen. That's not achievable. And then at the end, it's really not measurable because they're not going to do it. But if you make something like patient will ambulate 25 feet by post-op day 1, that's something that's measurable and achievable. And then you can extend it. If you come out with a goal of like patient will walk 3 miles day 3 post-op cholecystectomy, not going to happen. All right, so let's see if I stop. And of course, these Zooms don't really like me very much. Let's go into the other screen. All right. Oh, and if I forgot to mention, I do have a postmaster's in psychiatric nursing, so I'm not out here just winging it. All right, so here's your ATI Engage mental health thing. So admitting diagnosis, when you look at the concept case study that was given to you, what is the admitting diagnosis for this patient? Schizophrenia, bipolar disorder, anxiety disorder, anorexia, whatever the reason is. What assessment did you find? And put them in subjective and objective. Patient weight, 97 pounds, if we're looking at like anorexia. Patients, we could put down, usually their calcium, potassium, magnesium are all off. So you could put your lab values, whatever comes out of the case study. And then we're going to pick 3 problems. Trying to like think some off the top of my head. Client problem 1, depending on case study, could be like, lack of education, malnourishment. If it's an anorexic, their cardiac profile is going to be a huge problem. So you pick that problem. What are we going to do to intervene to fix whatever said problem is? And then what are some of the outcomes that you expect to see? Patient will slowly gain, 1 to 2 pounds per week. Patient will make healthy food choices. Patient will eat 100% of, meals twice a day, and you'll come up with stuff. Let's see if this is let me scroll down. Okay, so that is where you're going to fill those things out. Like, again, I said before, I use Adobe. So all I have to do is like hit this little fill in sign somewhere over here. Where is it at? With this one. And then this program just kind of like lets me go in and, write whatever I want on the screen. And then I could just upload that to the Dropbox. So here's your clinical scenario. This is the one from week 1. That you're caring for a 57-year-old attorney admitted to the psychiatric unit with a diagnosis of obsessive compulsive disorder. And there's my bird trying to hang out with us. Worsening symptoms since the loss of major high-profile court case. Okay, so he didn't just develop OCD. Like, this was something he already had, and now he's kind of lost his ability to control it. So the first thing you would do as a student is you need to go and look up obsessive compulsive disorder in your textbooks and refresh yourself on what exactly that is in the DSM, what the criteria is to be diagnosed with something such as obsessive compulsive disorder. He displays frequent hand washing to the extent that his skin on his hands has become excoriated with bleeding. That's an assessment data finding that correlates to the diagnosis of OCD. Is the skin on the hands is visibly excoriated. So that's part of your data. You noted that he's been having increased consumption of alcohol. Okay, so that's another one. He's articulate, well-groomed with extreme fidgetiness and anxiety. That's something the nurse is seeing. So that is part of your data. Here's your vital signs. If they are off, that's considered part of your data. Labs are fine. Orders anti-anxiety medication and SSRI, individual and group therapy, and discharge to outpatient care for CBT. Okay, so part of your nursing interventions and evaluations, interventions will be attending. Patient will attend, one group therapy, one individual therapy per week, or if they're inpatient, it's probably every day until discharge. So that could be part of it. And then say patient will follow up outpatient once per week with therapist. All right, so he's discharged. He begins to take his now I have a squirrel staring at me out the window. See, ADHD brain squirrel. He's begun to take his medications on a regular basis. He's been going to outpatient center for his CBT. Make sure you look up CBT and exactly what it is. Note some positive aspects of his life since beginning his transfer to outpatient. His vital signs are relatively the same. His blood pressure did come down a little bit. And of course, his labs continue to remain normal because we're not dealing with something that should affect the lab values. So that, in a nutshell, is a concept. Do your best. I know you're going to have questions. Stick the things in the boxes where you think it goes. And then if you are on the right path, I will tell you in your notes at the end of the week. And if you are not on the right path, I will also leave you notes on where to improve for the following week. And I think that's about it. Welcome to week 2. And I will get this uploaded in a little bit and open up your week so that you can start working on your work. I intend to get the next week open by the Wednesday of each week, because if you're like me, you like to plan ahead and see what you have to do and how much time you need to allot each day to a particular assignment. So that is my goal, but I am building this curriculum as a brand new employee. So sorry about my bird. We will learn together, basically. So let me stop sharing this screen. Okay. So if you have any questions, you have my email address. I think I'm pretty fast at returning messages. I'm trying to log in to the course every day to make sure I'm not missing anything. But feel free to send me messages. And I think that's about it. I'm going to review all of your lecture material for week 2 and add some information and upload another video later. All right, guys, you have a great day, and I hope you have a great week too, and start working on them concept maps.